everyone. Welcome back to the the 9th annual See Arthritis event. I'm Cheryl Cohen. I'm with Arthritis Consumer Experts, and along with our co-power, our co-manager of Arthritis Broadcast Network, Arthritis Research Canada. I'm so thrilled to be here today. We're nearing the end of our day of interviews with Anne Macleod. Anne is the past president of the Arthritis Health Professions Association, so the partner in this scientific endeavor here in Quebec City. And we're so pleased to have Anne, who is a physiotherapist. But as you're going to learn, the word physiotherapy or the words physiotherapy take on much bigger meaning when you're talking about some of the members within your association who have expanded education and expanded training, that really you do so much more than physiotherapy. Physiotherapy today, in other words, is a lot more than ice packs and heat packs, right? Yeah, or putting a TENS machine on. It is so much more than that. So we're really happy you're here, and we'd love to hear more about your practice, really, not yours specifically, but the evolving role of physiotherapy in rheumatology in Canada.
And I guess the Arthritis Health Professions Association, right, does represent, it's the only national organization that represents all healthcare professionals, researchers, and administrators who are passionate about improving the lives of people living with arthritis. Yeah. So we bring all the different disciplines together. Physiotherapists are certainly a large part of the group. And we also have many nurses, OTs, kinesiologists, social workers, pharmacists, dietitians, forgetting somebody.
Yeah, it's okay. You won't be mad if I've forgotten you. But that's hence the underscore of the word professions.
Exactly, professions. So multidisciplinary. Yeah. And certainly within that, with physiotherapy, there is a group of physiotherapists and some occupational therapists and nurses as well who have advanced training. In today's healthcare crisis, where we're looking at expanding the scope of everyone so that we can meet the changing needs, ACPAC is one of those training programs, so the Advanced Clinician Practitioner in Arthritis Care.
Ooh, that's a mouthful. Good thing you've got an acronym.
So I'm a physiotherapist. I'm an ACPAC trained physiotherapist.
In Ontario, we should mention.
Yes. So this is a national program, though. There are some ACPAC trained people across the country, and actually one in Ireland as well.
Oh.
But the bulk of us are in Ontario. And so my work day to day, so I work in a collaborative practice with our one local rheumatologist in Northwestern Ontario. And we've been working together since I finished my training in 2009, so for the last 14 years.
Wow.
And so my role, evolved from sort of physiotherapy role in arthritis care, where again, much more than ice packs and TENS. And, over time, as that's changed, a lot of focus on exercise and movement, right? And joint protection strategies and keeping people moving. And so I take those skills as a physiotherapist, and then I apply that now to my role. That's much more of a medical role. So as an ACPAC trained therapist, I really practice in that kind of complex, challenging medical world where I do the full rheumatology assessment, and through medical directives, then I have the ability to order and follow up on investigations, to do triaging, to manage. We don't prescribe, but we certainly do lots of the educating and talking and helping patients to make those decisions, getting them informed decision making, and then working collaboratively with the rheumatologist. So when I first started with West Fiddler, we managed to increase the capacity of his clinic by about 50%. By allowing me to practice to that extent of the scope. So it's a really collaborative effort where, I know where my scope ends and what I'm capable of doing, and working with patients and having the time to have those conversations and to do those assessments, do the physiotherapy piece, and refer them on to all the different disciplines that they need as well.
I'm sitting here listening to you talk about this actually huge scope, really. And the advocacy work that the Arthritis Health Professions Association has done, the value of membership is clear there. So if you're here and you're watching and you're not a member, you should become a member. So I think that's a great value proposition, and all of the new knowledge you're bringing forward at meetings like this. But I'm sitting here listening to you, Anne, and I'm thinking, wow, this is, the public isn't aware of this, right? They're generally speaking out in the grassroots where I live. They're not super aware of all of this, the complexity of this expanded scope of responsibility, obviously, but it's very similar to what's going on in pharmacy. We're hearing now Alberta's had prescribing, I don't know, right's the right word, but authority, scope, for quite a while. BC is just getting it, and there's some trepidation about it, but on the whole, I think patients are very happy because the wait times perhaps to see the rheumatologist are less. As you say, you're seeing more, but you might be seeing people more quickly. Is that a good assumption?
And certainly, at one point we were seeing people more quickly. We have now actually got a few great visiting rheumatologists, which is allowing us to see more people.
Yeah.
But the idea, ideally, with using people to the full extent of their scope, we can then get people in earlier,
right,
and get them a full kind of full care, right?
Yeah.
Where we're using all of the team members to provide the supports that people need.
And this scope helps to better model what, in my mind anyway, I don't know if our viewers share this view, but is patient-centered, like truly, because there's more people. It's you, one, but you're extending this other person, this rheumatologist, and it's double in my head, right? I've got two people now I could possibly rely on for that kind of information, that kind of support, that kind of medical expertise, which is great for us, right? It's great for us, meaning the community living with some type of arthritis. You'd obviously like to have more ACPAC trained folks, I'm guessing?
Yes, so there is the ACPAC program,
Yeah.
and certainly every year they're putting more people through, and we're looking at models of care, and how we continue to improve access and to improve the lives of people with arthritis, right? I think
that's the goal.
That's the goal, and I think across the board, when we're looking at all that, certainly making sure that every discipline within that, within our team is working to their full scope, right?
Yeah.
And that we can help patients meet their goals, right? So having access to those different team members and being able to have everybody work together and support is important.
In the cancer setting, cancer patients, generally speaking, those people that I have friends who've been through that experience, when someone receives a diagnosis, huddled up around them almost instantly is a team of caregivers. And problems generally addressed well. There are, I'm not going to say permanent cures in cancer, but there are things that eradicate tumor, eradicate disease, and people kind of think about being in remission or disease-free. That's not the case for us. And so I always argue we deserve to have a huddle form around us very early on in the diagnostic journey, I think. And so I'm such a big supporter of yours, as you know. Arthritis Consumer Experts works very closely with the Arthritis Health Professions Association. View you as just an amazing partner in the work we do. We feel so well supported by you, and I know our members do as well. Where I'm going with this is, I know you as past president continue to shoulder a lot of work, and you're really in this next year focused on the scope that you have, I think, led from the beginning, if I'm not mistaken, and that's around Indigenous health, around truth and reconciliation, and more importantly, what the Arthritis Health Professions Association is thinking about reconciliation. And you've been such a great partner with us in our Arthritis Learning Circle that is focused on this, as we call it, our journey along the path towards reconciliation and reconciliation, and being truthful about what is and isn't in arthritis. So we just want to thank you for that, but want to learn from you what it is you're thinking of and what the association is planning here in the next foreseeable future.
And I think, with AHPA, one of the things that we really appreciate is partnering with organizations, right? And amplifying the great work that you're doing and other patient organizations are doing and other professional organizations. So I think as AHPA, the more we can help to bring people to the table like you do and to partner together and amplify all those pieces, certainly helps to bring that information to our members and then for our members, then also to bring information to the people living with arthritis, right? So, as part of sort of this journey as well, certainly for me, there's been a big personal unlearning and starting to learn on this journey of reconciliation. And, as we look to partner with the work that you're doing, as well also looking at different initiatives that are happening so that our members are aware of the resources that are out there and how people start that journey of learning about colonialism and what our role is in that and how we dismantle some of those pieces and how we move healthcare forward in a way that meets the need of Indigenous people. And certainly that piece of learning and unlearning for me with all, many of my patients who are First Nations, I feel a little bit better equipped to ask some of those questions and sit in that discomfort and to be open to asking questions or to, when somebody tries to say, it's okay, Mom, you don't need to talk about that right and say, no, actually we do. And to take the time for that, right? And feeling more comfortable in this journey of learning and unlearning. So I think with AHPA, we're in the process of creating a new strategic plan moving ahead, and how does this fit in terms of all the equity, inclusion, and diversity, and reconciliation, Indigenous health, and well-being is an important part of that.
Yeah, I think you and I had the luxury of talking before we came into this studio, and I was sharing with you how I'd been part of a learning circle session. And someone said, it was actually last year's CRA meeting, and they had the focus was on equity and diversity and inclusion, and a number of really great presentations given by Indigenous clinicians, Indigenous arthritis researchers. And someone said that how we have to change healthcare is that the practitioner, whatever type of care they're providing, and the Indigenous person come into the room and with the thought bubble above their heads, what can I learn from this person today? And that really stuck with me. I shared it with you earlier. Sorry to bore you with it again here, but it's such a good point that you need to consider where someone comes from, what their cultural beliefs are, what their peer beliefs are, what their peer support is, what their family situation is like. And so much of that I know is considered in the scope of work that you're doing. And we're so happy to continue to partner with you, Anne, on these things. We want to remind folks that the calls to action number 18 to 24 are specific to health in the big calls to action piece of the Truth and Reconciliation Commission report. So we encourage you to read that and know that we are actively working together, specifically on number 22, which is working together in that unlearning and learning process and acting process to be aware and to find ways to better serve the health needs of Indigenous peoples on Turtle Island, and really truly form a meaningful partnership as clinician and patient. So we're very thankful to you, Anne, and to the association. We really thank you for your time. Our studio got a little backed up, and you were so gracious to keep returning. So thank you so much. Thanks for tuning in. We appreciate your time.